Happy holidays to all of you. Thanks for joining us again today. So again, welcome to our first informational webinar. Today, we're going to be giving you an overview of the exciting new opportunity. You see the acronym and initials there, ET4HS. What does it mean? It means the Earning Trust to Build Equitable and Healthy Systems program. My name is Jorge Fanjul. I have spoken to or met with, or even seen some of you in person. I am here at the Center for Public Impact, as you know, as our director, North American Director for Government Legitimacy. We're really, really happy to have all of you. Again, as I said, we're going to be doing a couple of these informational webinars. This one was really intended for our close friends and family list, folks that we've worked with before. And I know we've got a total of 7 cities represented on here now: Salt Lake City, Baltimore, Savannah, Detroit, Harris County, Carlton County, and West Hollywood. So we've got a great combination of cities and counties. And before we get started, I just want to make sure you all know that you can take your cameras off. You can go off camera if you need to. You can run off and do something if you need to. We're here for the hour, so please make sure you take care of any biological needs as needed. You'll be getting the recording of this afterwards if you do miss anything. So here's our agenda for today. We have a pretty interesting and I hope exciting webinar ahead of us, and we hope you came prepared with questions. First, we're just going to introduce the team and talk a little bit about who we are, a little about the organization. If you've probably heard some of this already. That's okay. We're going to keep that part brief since we know so many of you, and then get into the program specifics and structure afterwards. Then we're going to take about 15 minutes at the end for questions. And of course, the chat is open for you to share anything along the way. The team will capture it. If I miss it, I promise you that I will get back to it. So quick welcome, overview, questions, and we'll get to next steps afterwards. How does that sound? Also, is my sound good? Everybody can hear me? Thumbs up. All right, excellent. Thank you, everyone. So let's get started. And first, just some really brief introductions, because some of you may know me and you may not know some of our newer team members. And a little bit about CPI and the folks that are going to be working alongside all of you if you choose to be part of this program in the coming year. I'll mention the team structure here. As I mentioned, I am the North American Director here for Government Legitimacy at CPI. Giselle is going to be, Cordero is going to be our program manager for this health equity program with her team, Elise, Felix, Sam, and Valerie. What you'll see on here is also some of the other individuals that you may be engaging with, including our executive director, Dan Vogel. Particularly Felix, Sam, Valerie, and Elise, Giselle's team, they will be your learning liaisons for the scope of this program. If you're familiar with, and I know some of you are, the learning liaisons that you had last time, it's a very familiar model. The difference is the scope of this program is health equity. So, but you'll still have those team members that you can rely on for the work. And this is who they are. So I'm going to have them go off mute very quickly and introduce themselves. So let me first start with Giselle.
Thank you so much, Jorge. Hi, my name is Giselle Cordero, she, her. I am the program manager for ET4HS. I'm really excited to be here and get to know all of you.
Hello, everybody. My name is Felix Fernandez. I'm the senior associate on this project. I'm very excited for today and to get to know all of you a little bit more.
Hi, everyone. It's wonderful to see all of your faces. My name is Elise Delia Alvarado, and I am a senior associate on this team, and I'm looking forward to getting to know you all in the next coming year, hopefully.
Hi, my name is Valerie. I am an associate on the team, and I'm really excited to get to know all of you today.
Great. Thank you, team. So I'm going to move on as promised and talk a little bit about the CPI team and what we do really here at CPI. As many of you probably heard me say this, the point of our organization, why we are founded as a nonprofit, was really to reimagine government so it works better for everyone. So as an organization, we really do believe that government has potential. Government has potential to do very powerful and good things, and that reimagining systems allows for more equitable government to happen, and for some of the wrongs and mistakes that have happened in the past. And this is like generational, right? This is not during just our tenure and our time on this planet. This is the history of government. We believe that those things need to be acknowledged and rectified to build a future where government and people truly trust their government more and can work alongside to co-create solutions for a better community, better city, a better county, a better country for all. And that's what we do. Our partner, our financial partner for this program is the Robert Wood Johnson Foundation. Obviously, they are the views that we express do not necessarily reflect the views of the foundation. And I'll mention that because while they are the funder, this is a Center for Public Impact program, similar to some of the other programs some of you may have been a part of. So what is ET4HS? What is this whole concept of earning trust to build equitable and healthy societies? So building a healthier society, as we all know, really requires complex and far-reaching solutions that extend beyond healthcare. And we've seen, I think, time and time again, particularly during the pandemic, that addressing the social determinants of health and wealth, and that includes everything from education to healthcare to community relations to the environment, have really, really become all of the things that we see time and time again, but we're just seeing much, much more viscerally since the pandemic. These are the things that are disproportionately impacting all of our communities, in particular our communities of color, for really whom hospitalization and even death rates have been significantly higher than other communities. So we see these staggering examples of inequity, and these issues of inequity we know are creating public trust issues. And for those of you that have done the earned legitimacy work with us last year, this is what I'm leading into, in that what this program is we know there are trust issues on many fronts. We know there are especially trust issues that communities have around how public health and wealth and communities are being addressed. Is government working to make our communities healthier? And what exactly is government doing in some ways to inhibit from delivering these better outcomes to its residents? So more and more, it's imperative to build a culture of health across the nation that breaks down barriers and provides all citizens a fair opportunity for health and well-being. A little bit more on just some of the outcomes here, which I think is clear, because we're all doing this, right? We're all public servants. Even from my time being a public servant in New York City for about a decade, I saw that we're all doing work around equity. We're all doing work around creating healthier societies. And some of this obviously is happening around the country and around the world. So in coming together and designing this program, what we wanted to really do was help and work with local governments to develop more innovative approaches to address health disparities. And what's really exciting that we don't always get to do is, as a part of this program, participating cities are going to be joining an international network dedicated to learning and sourcing solutions for health equity issues. So realizing that this is a global problem, this program is a global program looking for global solutions for US issues. So by connecting with global institutions, international public health officials, and grassroots equity organizers, participants in the program, our participants, are going to have access to these individuals and really be able to work with them, relying on them as subject matter experts, having access to their case studies, having access to their knowledge, and how they have tailored some of their responses to address health issues. So it really is creating what often is said is a community of practice, similar to what we have done on some of our legitimacy and trust building programs. We're now expanding it with the focus of health equity to international cities, and they will be your brothers and sisters in this program. So that's really, really exciting. And I hope it excites you too. And so moving on to the next slide, a little bit more on health equity. So why health equity? Why is that? This very, very expensive looking graphic that our team put together today, which I love, really does, I hope, make the case, graphically speaking, for the paradigm shift that we need to look at when promoting healthier communities. And so looking at we've all are familiar with that medical kind of American Medical Association graphic there, like what is health? And I think for far too long, when we talk about health, we're talking about healthcare systems, all of that stuff, like my insurance and do I have my insurance card, and can I go to a clinic? Can I go to urgent care? And so what we're looking to say here is that, okay, while that is a part of health equity and health and creating more equitable systems, is really this other circle, right? It's about housing, it's about saving money, it's about getting exercise, it's about how you eat, it's about family and family institutions, it's about how you shop, it's about the environment. So there are all of these things that create more healthy societies. And for far too long, I think many of us doing this space, you're all civic engagement and community engagement leaders. For far too long, the US has focused, I think we've seen this, on the ground, in the field, as you and the team have seen many, many times over, is that the US primarily focuses on healthcare, without really taking these social determinants of health into account. And that's what this is meant to depict. All of these things, all of these social determinants of health are really, really key. And this needs to change, right? Because we now know that nearly, our data shows us that 1 in 5 Americans lives in low-income neighborhoods with limited access to basic needs like food, affordable housing, and job opportunities. So there are communities that don't only are not only lacking the left side of the equation on the actual medical healthcare front, but they're also lacking a lot of the things on the right side of this equation. So as part of ET4HS, we're going to be asking you to identify a specific health issue that your county or city is looking to address within this broader scope, whether the issue is connected to accessibility, infrastructure, delivery of care, pollution and waste, or engaging. And we're going to ask you to engage directly with community members to workshop potential solutions on what they might want to see too. So there's a little bit of a participatory design here too, where you're actually going to be doing, as you've seen for those of you that have done some of our programming with us already on Earn Legitimacy last year, doing community interviews and actually creating community plans. So we'll be doing that in tandem with our international cities that will be a part of this also, and using some case studies and understandings from them. So it's a very, very big family and a very, very big community of practice that we're looking to build here. And then how are we going to be going on this journey, and what is going to be our foundational pieces? Next slide, please. So this is probably common to many of you, and it really speaks to here at the center how we look at legitimacy and effectiveness, right? And how we define government legitimacy. Again, really this concept of trust is really what government legitimacy means, right? Trust and the trusting relationship between government and the people it serves. And when this trust is high, government can be more effective. So another way to look at also this very, very expensive graphic is that you've got your legitimacy and effectiveness. And as basic as this looks, what I'm getting at is here that we really do want you to connect with the higher trust is, right? Trust meaning legitimacy, the more effective and ultimately the more problems you can solve. So trust, as we all know from doing community engagement work, very much ties into, if you have community trust, you can then go and tackle with community very, very difficult issues like racism and policing, like affordable housing, like creating more equitable systems for BIPOC and LGBTQ plus and marginalized communities. So that's what earned legitimacy means, right? It represents that the idea that past actions have harmed individuals in all communities, and particularly marginalized communities, and the government must actually reconcile some of this and approach the work with a demonstrated commitment, right? Earning it, which is why we call this type of thinking earned legitimacy. We work to earn that legitimacy, aka trust. So in doing this and the work that we've done, the type of work and the type of cities that have done this work, some of you are included in that. We're creating this community that cares about these issues. And now we're coming to you again. We're saying, how do we make healthier cities actually happen? So we're going to go deeper. We're going to take trust and we're going to name it, right? We're naming that trust in its purest form for many cities and many city residents is, how is my government actually taking care of me? How are they actually putting their best foot forward in providing more healthier systems for me? And I think this program and this opportunity really helps to create that community of practice, brings in the perspective of some international case studies that have worked, and also will elevate some of the things that you're doing that have worked, that we'll also be able to share with the international community. So this is an exciting opportunity for us to take some of the work that we've done with some of you and others around trust in government, naming that there are some real issues in creating healthy spaces, and then actually doing something about it by creating a community of practice for all of you to really be thought partners in this space. So really, really exciting work. And again, thank you to the Robert Wood Johnson Foundation for being our sponsors in this. A little bit more meat on the bone here as we go through some of the aspects of this program. We're going to go very, very quickly here, and then I really want to get to questions as soon as we can. And please feel free to share anything on the chat. So through this 15-week program, participants are going to have, you will have the opportunity to build proficiency in core health equity skills. Really, we look at that in 3 buckets, right? Examining where power sits, sharing power, and reimagining more legitimate systems. This is very, very similar to some of the early legitimacy work that you have done. Again, I go back to it's going to be foundationally, while very similar, our topic and our scope of focus is going to be health equity. Let me move on to the next slide, please. Each city, ideally, you'll have a combination of city representatives and also community representatives. That's really what we have found. And we also, after doing a similar program with some of you last year, we found that your feedback was so integral. And what we saw from the cities that we've worked with and some of you is that you appreciate and you see value in bringing community residents into the program, not consulting them 90 days into the program, not engaging with them at the very end where you just show them a presentation of what you did, but from day one, where community residents come in and are part of the program with you. And what we'll be doing is we're going to help you to build out that team as we have in previous examples. And again, we're hoping that this time around, under this concept of how do we do an earned legitimacy program with a health equity lens, we're going to be focusing on your communities, your community leaders, and your community, ultimately the end users of your health equity systems, of your health systems, would be part of this cohort. So of course, each team, because we do a lot of guided work, is going to be also assigned a learning liaison. You met some of them already: Elise, Felix, Sam, and Valerie. They actually come with combined a lot of experience, years of experience with not only facilitating programs, but they've been in the field. So we've tried to build a team out here of folks that not only are good at understanding the work here that we've done at the center and understand the work that we've done with some of you in the past, but also bring in their own understandings and training that they've learned from their field work in social work and in community relations. So on participation criteria, what we're looking for, as many of you may know already, and you've heard me personally talk about this, we really do try our very best to create programs that are very accessible. And so for us, the biggest thing that we're looking at is I would like the opportunity to create some ideas and work with experts on creating some health, on reimagining health equity systems, if that resonates with you, but now you have to build a team. So for us, in doing this program, sure, we are asking for 4 hours per month and a team of 6 to 10 people per city. Is that ideal? Sure. The most important thing, though, is if you want to do the program, if your agency, if your city, if your county wants to be part of this, we should continue a conversation with you to figure out how we can do that. But we also understand the last thing we want to do is preclude access to anyone. And we will work with you to build space for your teams and to work with the capacity that you have, particularly to those of you that have worked with us before. We want to continue to work with you again. We want to be able to go deeper and deeper and deeper into your city, into your county, and continue to give you programs that we hope you will find valuable. So do not let anything preclude you from reaching out to us and filling out an interest form so that we can, or application, to have us work with you and build out your team. Ideally, though, it is, as we've done in previous programs, it's always great to have some senior level folks in the program. And of course, chief innovation officers, chief equity officers, directors of community relations, directors of outreach are great ideal individuals, and also our health equity experts at the local level, at the local city and county level, are also very welcome and encouraged to be a part of this program. Specialization is certainly helpful. If you do not have health equity specialization, that's okay. Part of this program is going to be taking everyone through a health equity, 2 days of a health equity training exercise, where we will be bringing to you some of the best and brightest minds that we have been able to find that are doing this work, and giving you free reign access to learning from them and really making them not our relationships, but making them your relationships moving forward. Let me move on to the next slide here. And as some of you have seen this already from previous programs, but it is very much here at the center. We believe in really creating upward and downward opportunities for engagement multiple points of engagement, how the program is going to be structured with the ongoing support of CPI, the Robert Wood Johnson Foundation, and other partners is going to be having you all do cohort meetings, right? So you will have cohort meetings as an aggregate. So all of the different cities will have meetings together, and this will be these joint meetings will be opportunities for cities and counties to engage with one another and to engage with subject matter experts that we will bring to you and engage on the curriculum, parts of the curriculum and learning journey all together. So think of the cohort meetings as almost like the big college class, right? Now, the city team meetings are really where you and your learning liaisons will be working on specific worksheets, learnings, even meeting with subject matter experts during that time, connecting with different cities, not in big groups, but in small groups. And then lastly, we're adding something a little new this time around to our program curriculums and just to our pedagogical journeys, and that's office hours. So you'll actually be able to get one-on-one time with key leaders in the health equity space. So whether that's leaders from organizations like Brookings, the World Health Organization, some leaders doing work at either Robert Wood Johnson, for instance, since they have quite an international practice around health equity. All of these leaders are going to be available for you that we work with during office hours for you to engage and learn from in an even deeper way. So you're getting the macro learnings, almost like this 10,000 foot learnings during the cohort meetings, drilling down to about, the 1,000 foot perspective from having your city team meetings with just yourselves, and then drilling even further down to that like 10-foot perspective where you'll be able to really be able to go deeper with some of our experts and learn more from them. So 3 bites here at the apple, and going deeper and deeper is really what we want to do with this program and giving you full access to everything that we've been able to curate for you. Next slide. Probably the most important slide here is the timeline. We're having this informational session today. Excuse me. We're going to be having a second informational session, and the second one will be larger. It's going to be geared towards cities we haven't worked with before, as well as cities that missed this webinar. So that one will be less of the friends and family list and more of everybody else that is interested in this. But of course, we wanted to reach out to you first because we've done similar work with you before, and you are very much part of our extended family. And we will always look to you for initial reactions, feedback, and really give you the first opportunities to be part of anything that we do. There will be an application for this program. Those will be due by February 15th. 2 weeks roughly after that, we'll let you know who's in the program. Again, we're trying very hard here to, if you want to be in the program, we will do our best and try just as hard to put you in the program, even if your team size or team membership isn't exactly what our application excuse me states. The biggest thing is if the desire is there, if you want to be part of this community, then we want to find ways to have you in it. And we start off on March 13th in earnest, and we're going to go all the way through really June as far as your participant portion. And then after June, we'll have some opportunities to do some bigger workshops and some share outs. Probably for those of you that have been part of our demo days before, where you got to present the work that you've done to 60, 70, 80 cities nationally and internationally, we'll do some of that post June. because again, knowledge hoarded is knowledge lost. You're all going to end up learning interesting things, coming up with interesting and new ways of looking at health equity, I'm sure. So we want to make sure that your learnings also get shared with others that weren't in the program. Okay. Next slide. Thank you. So and I'm almost done here, and then we'll open up for questions. And please remember the chat is also open. If I do not get to your question, the team will remind me and keep me honest, and I'll make sure I will get to it. On end of program deliverables, really every city that we work with, we really will work with you to create a capstone project and experience at the end. And that's going to include a toolkit of exercises to help build community trust and encouraging co-design innovation techniques in the health equity space. So you're going to have your own booklet, essentially your own toolkit that you'll be developing with all of the core skills and learnings and relationships and case studies for the program. We're also going to help you then take those toolkits and skills and create a plan of action, right? Something that you can point to is like, these are the things I would like to do. And that will be yours to take and to share with other cities. And we did some of this demo day work last year, but more importantly, we want you to also share it with the rest of your city, the rest of your county, and take this opportunity that you have to really think very strategically about what we can all be doing better and share those learnings, share those experiences with others. So we will help you curate artifacts at the end of this program and tools that are going to be very unique to you. And of course, I mentioned a couple of times over, many of you have already worked with us on things before. You're very much a part of our family here at the Center for Public Impact. And so as we continue to build out our legitimacy, our government legitimacy network, our earned legitimacy network, our health legitimacy networks, you continue to be a part of those. And we will continue to grow this family of people that are looking to reimagine government so that it works better for everyone. Next slide, please. I think we're almost done here. So hopefully I've made some good points here, and I've got you interested in at least asking questions and being really open with us on your feedback. Again, you are very much our friends and family here, as I've said many times, and I'm interested in hearing your feedback on this, how you feel about the program. Would you be interested in being part of it? We do have an application for you to look at, again, just as an idea to help you get your creative juices flowing on, is this something that we could do? And of course, we have an email. You can always reach out to me at jorge@centerforpublicimpact.org. Also, we have an email address for the team, et4hs@centerforpublicimpact.org. And again, that's jorge@centerforpublicimpact.org and et4hs@centerforpublicimpact.org. So you can contact us through both emails. This is the end of my formal presentation to all of you. Thank you so much for sticking with me to the end.